Well, during the national debate over health care, we heard a lot about bending the curve when it comes to costs. But some costs were never counted, and the trend line for total spending could go up, not down. Jim Engel reports now on the true cost of the new health care law. Hi, Jim. President Obama repeatedly pledged that health care legislation would, quote, not add one dime to our deficits either now or in the future. Some are challenging that assertion at this point.
Absolutely. You know, there were a lot of tricks during the process to make that happen. For instance, the bill originally included money to prevent Medicare doctors from suffering a scheduled 21% cut in fees, but it cost too much, so they simply took it out of the bill. Listen.
If we were going to, quote, fix the doctors' payments for the next 10 years in one fell swoop, it's $375 billion. That's a pretty hefty price tag, and not shockingly, they left it completely out of health care reform, choosing to ignore this big bill.
Now, without the doc fix, the health care bill was projected to save about $140 billion over 10 years, so the $375 billion cost of the doctor fix alone would have pushed the bill $235 billion into the red, breaking the president's pledge.
So it would really be $235 billion in the red instead of a deficit reducer?
Well, there's more. The problem is the bill added other things it did not pay for. For instance, the IRS will have a massive new responsibility to administer the subsidies for health care. Congress added dozens of things but did not approve a single dollar to pay for them, making the cost of the bill look lower than it actually is. If Congress intends to live up to the bill it passed, the Congressional Budget Office predicts that will cost another $105 billion or more, which would mean the bill would add some $340 billion to the deficit over 10 years. The health care bill will also increase the nation's overall spending on health care, in part because it adds coverage for more than 30 million more people and because baby boomers are getting older and using more health care. As a result, total national health care expenditures will actually increase by $310 billion by 2019. And the Congressional Budget Office says that will increase federal spending in the next 10 years and for most of the following decade. But one Democratic analyst notes we do get something in return.
Yeah, what you have to remember is it does that there's 30 million more people who are insured at that point.
Now, lawmakers are still arguing over whether the health care bill will improve health care or make it worse, but it seems clear it will not reduce spending either for the nation or the federal government. Patty Ann.
All right, Jim Engel, live in Washington. Thanks.